I think we'll get started.
Wonderful.
Yeah. So, Dr. Morrissey, you have an EMDR Institute, and I learned about you from I guess it's like a article about a podcast on EMDR and brain injury. And I can share that I've had bad experiences trying to find some help at that realm, and it led me to
Okay.
be interested, and finding you was helpful. So, you can share your slides, you can introduce yourself, and
There are some images that I can show.
if it's helpful to just discuss, sorry, I have a cold. If it's helpful to just
Sorry.
discuss, we can do that. Because if
Yes,
we
I
don't
just
want
want to
to,
show some scans about the brain. Let me see my advanced provider stuff here. They're basically doing the wrong kind of scans to be able to see brain injuries. So most of the time they do, let me see axonal damage here. Most of the time they do just an MRI or a CT scan, which if you know anything about that, all that does is check for brain bleeds or a break in the skull. Where what they should do is an MRDTI, and that's what I want to find so you guys can see the differences here. There we go. Let me share this.
What does those initials stand for?
Magnetic resonance diffusion tensor imaging.
Hmm.
Okay. And so this is what the DTI, MRDTI looks like.
Is this a relatively new technology?
Yes, just in the past 5 years. So it's more common now in Colorado. Instead of one place, we now have five.
Hmm.
So if you look at the image on the left, that's a brain that's never been injured. And you can see how beautiful all the striations are, all the colors, the sagittal views, everything looks great, all the connections. The brain on the right, that's a brain injured brain. And so when the doctor says nothing's wrong, it means there's no brain bleed and your cranium isn't cracked, but they're not looking at the deeper structures and the communication that is messed up with the brain injury that this picture on the right shows.
Can I ask you a question?
Yes, please.
I don't know if you're going to be able to answer this, but how does this different than a PET scan?
I haven't seen images of PET scans and brain injuries, so I can't respond to that.
Okay.
Um,
I can share, and it's funny because I'm trying to remember the mechanism under which PET shows brain activity and certain structural stuff, but it has to do with like a compound breaking down. I know that the MRI shows blood flow, the bold response, blood flow oxygenation, and I also can't remember what CT shows. I used to know this stuff, and then but the DTI shows the white matter tracks in pretty remarkable precision. And
yes.
I was a technician in a lab that was using this at UCSD about 15 years ago, really cutting edge at that time. But the connectivity gives a lot more information. But I would say that it doesn't show everything because it doesn't show the synapses and the somas, but it still is revealing much more than the techniques that don't show anything. And when I had MRI done, the doctor's like, he's fine. There's no brain damage. And I was like, what are you talking about? So it was kind of annoying, just to share my experience. But yeah,
Yeah, and the reports that come off these MRDTIs, they are phenomenal in how the person who reads them can say, "Oh yeah, the connectivity and the communication between here and there is going to be a problem. It's going to cause issues with processing speed. You're going to notice memory issues, like all this other stuff." And so it's like this is important to have out there. Yes, Liv.
Hi, thank you. Thanks for putting this on. This is really interesting. So as a brain injured person, as a let's say a newly brain injured person, depending on what the brain injury could look like, given this type of imaging, what would I mean? Again, understanding that I don't know what your level of expertise is, so forgive me for that,
Sure.
but what would be kind of a good track to kind of follow given someone who has, let's say, who has
What?
had acquired brain injury, for
Yeah.
example?
Yeah.
Okay. So, and there are so many categories of brain injuries. Parkinson's, COVID is a brain injury. And so the track, at least that I use, is EMDR. I found phenomenal results using EMDR. So with the research that I've done, and every organ in the brain oscillates at its own frequency, right? And then the brain injury comes in, and it's like, I'm in the generation where we had actual wind-up watches and cuckoo clocks, and you can see the inner mechanisms and the big gears and the medium-sized gears and the small gears. The smaller gears have to spin faster than the bigger gears. And if you consider that that's what's going on in your brain, and then you hit that cuckoo clock, it's going to jump the gears, and they're either going to grind or they're going to spin at the wrong oscillation. When that happens, communication, not just axonal damage, but communication between the different regions is going to be mixed up, right? And that's where you're going to see the headaches, the sleep disruption, the mood disruption, all of those things, right? And so EMDR, when done correctly, and all the research I'm doing from around the world is that the proper speed is around 0.75 to 1.5 hertz, which a hertz is one eye movement per second. Okay, so it's below that or slightly above that. That is akin to what happens to our brain when we go into deep sleep, and it goes offline and then it resets, and then it either stores for long term or it dumps short term for the next day. So that more like a trickle charge coming in my opinion. I'm trying to look at the theory and look at physics and understanding the brain better, so it's just not my opinion. But I'm looking at this going, okay, if it's coming in like a trickle charger, then it is allowing the parts of the brain that were off kilter to go back to their normal oscillation, creating homeostasis again in the brain. And that's when I'm looking at it, when everybody sees improvements in functioning, in sleep, fears, phobias that accompany that. Biggest thing, if there's more than one brain injury, you are prone to have another one, because if it's supposed to be doing this and it's doing this, right? Your proprioception part of your brain is off, and your balance is off, your judgment, your visual acuity and judgment's off, and you're going to be prone to have another brain injury, whether smacking the back of your head under the table, into your car door, in a wall, tripping
But
and falling.
but the thing is, you may not even be aware of it, correct?
Correct. That's why I'm trying to get the information out there so people are more aware that it's not just because, oh, like cancer, well, once you've had it, you could get it again. They're looking at TBIs like that, and that's wrong. It's because something is shifted in the brain, right, that is making you more susceptible to have another one, because your balance and your vision and your depth perception is all off.
That's a great so you just touched on a bunch of points that I've been also collecting ideas about and trying to show more than just my opinion, but it's also my brain injury experience. And I really appreciate what you said. And also, Liv, um, may I answer in addition that I think that DTI imaging is much better at showing if you have evidence for what you're dealing with, all of a sudden you're not crazy or imagining it, or you have some proof, and that's a really
Yes.
big step. Plus I look at it as we have core problems, core things that are injured and we experience, and then there's the problems that lay on top of it that get aggravated, like the headaches, the migraines, the visual stuff. Plus, then you are in worse condition, and then you can bump your head again, or at least live in this state that you're constantly aggravating and making things worse. But if you get the right help, that's so important. And then what is the right help? That's why I was interested in EMDR, to think of it as a shifting of the oscillations and shifting of the global levels of activity. That's really
Yes.
cool. That makes a lot of sense. And I have a question about, so you think that EMDR is shifting the brain injured parts versus the psychological trauma that comes from having a brain injury, which is what EMDR is known to help with, you know?
Yes.
So you think
It
it,
does both. So if somebody gets like acquired, I had a lady in her mid 30s who had a cerebellar stroke, and they're
Yeah.
the most rare. And when I did all the research, only 1% of all strokes occur in the cerebellum. And when that happens, it's usually likened to a brain tumor. And she did have a brain tumor causing that. So it wasn't, she didn't get into an accident. There wasn't anything traumatic per se. The traumatic part of the brain injury is the insult to the brain, right? So every brain injury isn't going to have post-traumatic stress with it, but there may be anxiety or fear about it happening again. Because let's take that lady, she was driving when it happened, right? So then she had anxiety about driving. What do I do if it happens again? So I think EMDR is twofold in that it does reset the oscillatory speeds in the brain, and it can work on the post-traumatic if there was a fall, physical abuse, domestic violence, some kind of other assault to the head.
Right. And the acquiredness of the brain injury part. And
Yes.
so everyone here is, I believe, all brain injured, and I've had discussions with them about the internal problems that they have, which are what I call core problems, but it's the root of what broke, what got injured, and it can be as like in the movies they talk about memory, but it can be a whole lot of other stuff.
Yes.
That's the stuff that I think remains and needs to be improved and needs to be worked on. And also, a big part of it is learning to not make it worse because you
Yeah.
can easily do that.
The biggest thing is you cannot work harder to make your brain get better. That is such a lie. The research that I'm looking at is these supposed experts, psychiatrists, doctors, sports injury people who specialize in the brain, military, etc. More than 50% of them got the test wrong because they're still handing out information from 40 to 50 years ago. Sit in the dark. Don't do anything, right? You got to try harder, do all this stuff. It's not. That's like saying, hey, I broke my femur. I need to get up and run quicker so I can make it heal faster. You have to allow a certain amount of time for inflammation to come down, right? I usually recommend a month after an injury before I start EMDR. But during that month, I'm doing history taking, calm place, so that we're not getting to the active part of it until that month and they have time for their brain to regulate. The other thing I wanted to mention is the future of research. They're looking at breathalyzers.
For
They have
what?
found that there's 150 different chemicals that we expel, and they're finding the ones, they're isolating the ones that brain injured people expel versus the neurotypicals who haven't had a brain injury. And that's from the Texas A&M. I've got that research article where they're hoping within 5 years they can make a breathalyzer to be on scene with EMTs, coaches on a football field, a doctor's office. And instead of debating, well, do you have these symptoms? What are you experiencing? Do the breathalyzer. Oh, yeah, you are like a flaming TBI. This is the protocol we need to do.
But that would be a diagnostic tool.
Yes, it would be, but at least it's better than going, I think I have a brain injury. Oh, no, you can't have one. You didn't go through anything, right? Because a lot of doctors don't acknowledge the coup, counter coup, and whiplashes from car accidents,
Right.
Yeah.
Don't even get me started about doctors.
Yes.
We're all on the same boat.
Let me ask you something. In Bessel
Sure.
van der Kolk's book, The
Yes.
Body Keeps the Score, he talked about EMDR quite a bit.
Mhm.
And the thing that struck me is that, where he talked about how EMDR for somebody, one, it doesn't necessarily work for everybody, but to the extent that it does, somebody may only have to go through 2 or 3 sessions. Others may have to go through maybe 10 or a dozen. But
Mhm.
it's not something that goes on for like a year or 6 months or whatever. Do you think the thing that I'm wondering about is the remedial, not the diagnostic part of all this, which certainly has its value, but I'm wondering about EMDR as a remedial tool. So do you think that argument that Bessel van der Kolk presented in his book holds true for a brain injury, or is that really subjective to what the brain injury is?
Well, I've got some clients who've had so much trauma that I've had them for 3 years, and they dissociate a lot because it started pre-verbal and
So,
it's hard to get to,
okay.
right?
So it
Other
could go on
people,
for some period of time.
it could. For brain injuries, if it's a single brain injury, they've
Yeah.
noticed improvements in as little as 6 to 8 sessions. For those, like the most I've ever treated has been 11 brain injuries, and it's the succession. So it's how quickly. So this young lady had 3 brain injuries in a year, 2 that occurred within 4 months, 1 that occurred 6 months later. And that was like their worst year, but 11 since she started playing sports. So she was having a lot of issues, but it only took me about 6 months of working with her to get her back on track. She was like a microbiologist, like a brainiac, studying stuff, researching all day long, and she wanted to get back to work. So it took
Mm.
about 6 months, and she was noticing improvements all along the way. But to get to the point of being able to conclude therapy, it was 6 months.
I actually, so I have 2 experiences with EMDR. First is following my stroke. I actually did EMDR for about 4 months.
Okay.
And it was to deal with the acute nature of the stroke. And then, but because of kind of, the way trauma kind of manifests sometimes, I'm now in this place where, as a result of, again, trying to kind of get back to life, whatever it means, whatever that means, I had to, so I did I had PTSD, and then I wound up having, I did like CPT to counter that. And it actually did help, but I still needed that additional support in this is now 3.5 years following my stroke.
Jeez.
So meaning like it's still kind of, it's still, manifesting in a different way, which is why I'm on my second kind of practitioner, because I think it's a different, it sort of manifested, kind of created something completely different as a result of all of that. So, but I've really appreciated this go versus at 6 months, because yeah, I think there were a lot of unanswered questions at that point, but I just wanted to
So
kind of share that.
thank you for sharing, because that brings up, I wrote this down, is first of all, if somebody is not specially trained in brain injuries or EMDR for brain injuries, their natural instinct is to jump in at the worst thing, use eye movements, and go as fast as possible. And those are all wrong for brain injured clients. Right? You don't jump in at the top. You start on the lower things and work your way up. If there's no trauma and you have one event, you chunk it, you break the event down into chunks, and you start at the lowest part of that. You never use eye movements because it can cause headaches, right? So auditory or tapping, and you never go as fast as they do. So if they're doing that, then they haven't been trained and they're doing it wrong, and they can do harm. I had a mother call me from Kansas or Missouri. Her teenage daughter went to somebody after a car accident who wasn't trained, jumped in at the worst, used eye movements, and was doing it as fast as could be. The girl ended up with a psychotic episode, which they called it psychotic, and she was hospitalized. What I look at that to mean, because my sister's 3rd brain injury, she could have been labeled psychotic. When your brain isn't functioning like it's supposed to, and you look at it like we've got 20 different radio stations in our brain, each at a different frequency. When you get a brain injury that bad, what they're hearing are those different radio stations. And if I heard 6 radio stations playing at the same time for hours, I would feel like I was going crazy. Okay,
Yeah,
so
that actually makes a lot of sense.
yes,
Yeah, that
exactly.
makes a lot of sense.
Randy, you and I have used the term microchips for what I believe Dr. Morrissey's describing as those radio stations, because they're all get injured and here I can, yeah.
I actually shut down physical collapse after my injury in a neuro-ophthalmologist's office if they tried just from them asking me to move my eyes back and forth across the room.
Mhm.
And they asked me to do it 10 times. I was shutting down between 5 and 10. I couldn't even, I literally physically collapsed in the
Yes.
process.
Were you
And that
going
was in the early,
unconscious? Were you going like
no,
unconscious?
it's kind of like Dan's heard me talk about this many, many times, but it's kind of like literally the car running out of gas. And whether I want to move or anything, my brain just starts shutting down. And it
Yes.
appears like I'm going to sleep. I can hear
Yeah,
everybody and understand everything,
that's
but
what I
my
mean.
my eyes start shutting. I start sloping to one side. It's like my
Right.
body's just done, no
That's
matter
what
what I want to do.
that's what I
Yeah.
meant. Like
Have
Yeah.
you
that's
ever played pinball? So
Oh,
I grew
that's
up in the 70s. Pinball came
yes.
out.
I just turned 60 this week, so
Awesome.
yes.
So you'll get the analogy. When you hit the flappers too hard, the machine goes on tilt. The lights are still there, but the
Oh, that's a good
mat
one.
is not
I
moving.
I
And that's
describe my
what
life
happens.
now as a pinball machine. I'm just bouncing between the things because, or a toddler moving about a room. I don't have any focus or, yeah.
Right.
But
But it's
I
like
like
that
that
tilt
pinball.
and it
Yep,
freezes up, and then you can't
perfect,
get any action out of it.
perfect. Thanks for illustrating that. That's one I'll use in my quiver of how to explain this to people that don't get it.
And
Yeah.
Thank
them,
you.
I really appreciate this discussion because tell them also that I believe every brain injured person that I've met and in my experience is you have a limit that if you hit that limit, tilt is a good way to put it, but the work to improve becomes making sure you never get to that limit, and that's really, really hard to
Yes.
do, especially if you don't have support.
Yeah,
Yeah,
I ended up in the hospital twice when I was pushed past where my brain could actually handle. So
Yeah.
for 10 weeks in 2023. So yep, I'm fully on board with everything you're saying because I lived it.
Do you think that there is a time limit in terms of the effectiveness of what EMDR can do as a
Ah,
remedial tool?
thank you for asking that. No, there isn't. One gentleman I worked with had his brain injury when he was somewhere between 12 and 14 from a bicycle getting hit by a car. And
Yeah.
of course, we didn't wear helmets back then,
Yeah,
right?
right.
So he ended up with a seizure disorder. He was on medication. He couldn't work. His wife left him. Like, it was a horrible country song, so to speak, right? So
Right.
by the time he saw me, 22, 32, it had been 25 years since his injury,
Huh.
and he still had great results. He needed less, he was having less seizures, needed less seizure medication. He was feeling better, and he ended up getting a part-time job and then being able to visit with his children. So there's moderate rated success, and I think that depends on where the brain injury is, not so
Right.
much how long it's been since the injury. And did it go into the white matter and axonal damage, or did it stay in the gray matter?
Do you have any thoughts or comments about the impact of EMDR? Let me back up a second. I'm using this somewhat loosely. There are two components to rehabilitation. One is the cognitive rehabilitation.
Mhm.
You know, learning how to think again, add again, read again, whatever those cognitive deficits were. And that is an incredibly arduous undertaking.
Yeah.
What I'm finding is that that is like kindergarten compared to dealing with the emotional impact of
Right.
the injury. So what I'm wondering about, do you have any thoughts or comments about the impact of EMDR in terms of emotional dysregulation or
Oh, yeah.
re-regulation or however you want to put
Yes.
it?
It definitely helps to regulate the brain. So, what they're finding is the depression and anxiety that occurs after a brain injury is
Yeah.
not your diagnosable
Yeah,
anxiety and depression. So they
right.
don't respond to the usual anti-anxiety or antidepressant medications. And that's proven in research, not my theory.
Right.
They do not respond to those meds. So they just keep throwing different meds at you. We'll try this, we'll try that, we'll try this. It is a different kind of depression. And I believe that's because of the oscillatory changes that happen, that it is not neural, it is not a neurochemical issue, it is an organic issue. And I'm finding that EMDR helps that organic issue, so depression and anxiety improves. And they don't with the medication when doctors throw meds at it.
Can I just say that I have a really, really good talk in this series about that form of depression from one of the experts that published on it, and it's a very brain injury centric phenomenon, and that he shows the network that seems to be underlying it, how a lot of problems with brain injury have a footprint that looks like other problems, but is not because of the actual brain injury underlying it. So he gets into the details of the circuits,
Boy, talk about a
Nice.
conundrum.
how transcranial magnetic resonance
Stimulation.
oh yeah, Dr. Siddiqui, it's a talk from about a year ago. It's an excellent talk, but it's exactly about this point, and it's hard to know if everyone has the form of depression that he's studying, but it's certainly different from depression that is textbook, that is what
Yes.
is, and and of course other people also have depression because of our one's condition, but yeah, there's some really, really good science on this. One talk was in this series. I had another thought, but sorry, I forgot. Anyway,
That's okay. Yeah. So the ones I see are the ones who don't even know they've had a brain injury or that their symptoms are from it. Like recently, I've got a couple new clients who had a head injury when they were 4 and then again at 7. And then they're like, oh my gosh, like I've been on ADHD meds ever since I can remember. I've got a learning disability, right? Well,
How old are they now?
32, 35, something
We're
like that.
talking essentially a lifetime, but go ahead.
Yes.
Yeah. Okay.
And so when I ask and I explore that, they go, oh, well, yeah, that happened when I was a kid, but the doctor said my brain was so young and plastic. I'm over that. That's not what's going on. And I said, I hate to tell you, it is what's going on, right? Your hard time reading, your hard time with math, your hard time doing these things and having focus is not ADHD. This is from your brain injuries.
There was, I don't remember who it was. There was a interview I saw of you with two other women. I think it was something 57 or something like.
Notice that? Was it?
Yeah, I think it was
Okay.
right. I noticed that. And the thing that struck me was you talked about, people who say they do EMDR as a therapist, but how important it was I mean, you just talked about it a few minutes ago, finding somebody who was well experienced, well educated, well versed in EMDR and brain injury.
Mhm.
That is not so easy to find.
It's a unicorn.
Yeah,
Yes.
right. So, so how do you, so what do you do?
Reach out to me. I'm keeping an Excel spreadsheet of everybody I'm training, US, Canada, England, Australia, New Zealand, like wherever you guys are hailing from. And there
I
are some.
actually was in
Mhm.
touch with Barbara, your assistant,
Okay.
and she told me that you were going to try. Apparently, there are state laws that regulate telehealth, which I was not
Yes.
aware of. I'm in Oregon,
Okay.
and I did a search of EMDR therapists in Oregon. There are a lot of people who claim to do EMDR, but I could not forget the interview that I watched on Notice That.
Yeah.
And I had one experience with one person who, as far as I'm concerned, wasted a year of my life. I don't think
Um,
she knew what she was doing, but she was certified in EMDR. I mean, hindsight being what it is, I think that she may have been certified in EMDR and she's done it a little bit, but was completely clueless with brain injuries and not
yes.
well enough versed in EMDR. I
that's the
don't think there
reason
is.
we're doing this talk, Randy. And yeah, so how are you getting the information out there, Dr. Morrissey?
Yeah, how
My
do you,
website talks like this. Notice that the Amdria podcast. I keep the list. And so every time somebody gets trained, the last question I ask them on their test is, how comfortable do you feel now treating somebody with a brain injury? And if they say, I feel more confident and I am going to start getting into this, I put them on my list for referrals. If they say, like, I was just taking this because I work at a brain injury clinic and I was curious or I'm interested, or this is scaring me because I want to know more about the brain before I jump into this, I don't keep them as a referral because I'm not sure that they're going to use it and practice it and hone those skills.
Yeah,
Is it possible to do EMDR and treat a brain injury over the computer? Or
That's
is
all
this
I
something that
do.
has, what?
That's all I do. So since COVID, all I've been doing is virtual therapy. During COVID, I treated people in Utah, Chicago, Washington, Kansas, Wyoming, Montana. But since COVID lifted, they've gone, nope. It's all about money. We want to keep our money in our state. So
Yeah.
you can no longer treat in our state unless you get licensed. I can't get licensed in all 50 states. It's too much money annually to put out all the requirements to do.
Right.
So that's why I thought I've got to make sure people are trained. But since then, all I'm doing is treating people virtually. So yes, it is possible
Where are you located? Just curious.
in Pueblo, Colorado.
Colorado. Okay.
So you have to stick to the state to help treat people in Colorado?
For Colorado, I'm also developing a spreadsheet where I've got, I think, 30 of the states right now that allow for treatment in their state. Let me see where I can find it. It's called the telehealth rules, telehealth state laws.
I can give, if it's okay, share your email with people here and they can email you.
Yes.
Yeah,
Yeah,
that'd
but
be
the-
awesome. Or in the
Great.
website. In the
Right.
website, please.
And she has, yeah, I'll share her website. If you've got the invite for this, everything is on there as well.
Okay.
Yeah,
you.
it's amazing to think of how, because brain injury is a major problem. Plus, it's not
Yes.
understood and not believed. I think that this
Yes.
discussion is good for them to help the outside world recognize that it's an issue that's different for them. I'm still arguing with any therapist that my brain injury is any different from them, and then they say, "Oh, well, that happened so long ago. You're fine now." I'm like, "No, my brain shifted. I had these things that changed in me." Oh, that I remember my questions now. So, two thoughts is that one thing with brain injury improvement is I see a combination of factors working to help a person, and I think EMDR can be very helpful. But then you would also focus on if they have a, let's say, a speech problem. Who here? Holly has a dysautonomia, injury to autonomic nervous system, and Randy has it's alexithymia, basically inability, and so those would need other specific, therapies, other specific help. But the
Maybe,
EMDR
maybe
thing is
not, because I've seen other patients with TBIs with those issues, and
right.
those symptoms improved with EMDR.
That's great. Yeah, that was my question. And then the
Oh.
other question then is more specific to alexithymia, the inability to feel, perceive, and have connection with your feelings would be very hard if you go into EMDR with that problem. Have you faced that kind of situation or faced that kind of problem with a client, and how do you deal with that?
So I integrate a bunch of things. So I use somatic therapy. If you can't connect to an emotion, and
Yeah.
some people can't, fine. When you think about this, what comes up in your body? My chest starts to flutter, my back aches, right? My stomach does swirlies. Then I know where they're storing, like Bessel, you're storing that trauma in your stomach, your chest, your back, whatever it is. And I go with sensations. Notice the sensation. Is it hot or cold? Is it hard or soft? Is it fluttering really fast or is it moving slow? Right. And so by asking questions, I'm still activating the neural network in a different way, kind of like going back door rather than through the prefrontal cortex. Right. And let me write that down because that's another thing I wanted to bring up. It's still a way to treat it and ease the symptoms. And then those emotions start to come up afterwards. Okay.
Right. And so what if it's not bodily, or what if they feel like it's only in their mind, kind of a thing?
Or better
I've had-
yet, what if there's a disconnection somatically as a
Mhm.
result of the injury? Then what?
Well, is there also a disconnection between the body and like, is it a compilation of all of this? No emotions, no body, no whatever?
Right. I imagine each person will be different, and you
Yes.
search for it. You search for what you can tap into. Yeah, that
Yeah.
makes a lot of sense.
So one thing I wanted to say before we moved on is the prefrontal cortex. All talk therapies, but EMDR appeal to the prefrontal cortex. If you've had a front to back injury, anything that hit in this region or this region, your prefrontal cortex is shut down. So you're going to find the therapist getting frustrated with you. You're not trying hard enough. You're not practicing. If you would just do the things we talked about, do your homework, bang your head on the wall, because any therapy or any PTSD, this part of the brain shuts down. EMDR can work bottom up, right? So then you can appeal to
Jesus.
the part of the body, you can appeal to the emotions, you can appeal to the sensations, you can appeal to the thoughts once you do enough of this, and this starts to come back online. Now, the only caveat is somebody who had such a shearing of the white matter in the prefrontal cortex that, like the movie 51st Dates or 10-Second Tom, I haven't had any luck with brain injuries that were that severe.
Right, and in that case, it would be a frontal work afterwards, but at least it helps overall. And I like that bottom up perspective, especially given certain people it's hard to get initiated. So it does sound like it could be very helpful to get
Yeah.
things started and improve. Does anyone else have any questions?
I have a question. I know, Michelle, you had talked earlier about not doing eye movements, but doing auditory or tapping. Like
Mhm.
if, I have, for example, I have a brain injury and I actually had kind of 2 months apart, and I've always wanted to try the EMDR, and it's actually on my to-do list.
Good.
But I want to do it with someone like you said who is trained in brain injury specifically, because the ones that aren't, are you saying that they would probably
Hurt you.
start with the eye movements, which could be very difficult?
Yes, ma'am.
Okay.
Yeah. You can do the drawing protocol. So as long as you haven't had any issues with your hands, if you can't tap or you don't have, so I tell people you can, they can use foam balls and they can just gently squeeze them for the bilateral stimulation.
Mhm.
The website I have will deliver the auditory, but there's a drawing protocol that I will use for some people, and they will gravitate toward the color that represents their emotions, even if they don't know what emotion they're feeling at the time. And so I see a shift in the colors that they use as treatment progresses. It goes from like the dark black and the bright reds to more like pastel colors that they're choosing. So you can see the shift.
This is fascinating as hell.
Yeah, I'm sorry. I get excited and I
No,
talk
no, no,
fast,
no,
and I know
no.
everybody
Don't
processes
apologize.
slower.
You
Okay.
don't
This is
need to
really good.
apologize.
Holly, I'm gonna ask a question, and then you can
Sure.
ask. Given what you just said, can you explain how to think of EMDR? How can you switch from eyes to tactile to auditory? Why is that possible? Because I think people don't know how to think about it in that sense.
So we've got 3 different processing centers in our brain. Everybody knows about the occipital. It is the largest processing center in the brain. But if you're injured and you hit the back of your head or it affected your eyes, you stay away from this, because we take in millions of data bytes information visually a day, and you will be flooded with information if they do anything visual. So then you have the kinesthetic part. Trying to figure out how to hold it without my brain falling out here.
Welcome to our world.
Okay, so the band across the top is the kinesthetic. Anything to do with the hands or the bodies goes across the band this way. And then you have auditory processing. So the kinesthetic is the second largest. So anything you can touch, draw, feel is the second largest processing. The third processing center and the smallest is the auditory. And that is going to be right above the ears. Okay. And so that they always said in all the research, it's the smallest. It's like shoving a steak through the top of a pop bottle. It's not going to work. Don't do it. I find that with EMDR and brain injured people, using auditory slows it down and the speed. So only enough information is coming through that pop bottle and they don't get overwhelmed. You guys get overwhelmed easily. And so this is a way to ensure less overwhelm comes in. Now, when people start to get better, they'll go, hey, can we add in the tapping with the auditory? Sure.
When you
Now
say
we're using two
overwhelmed,
processing.
you mean flooding?
Yes.
Okay.
Yeah.
Okay.
And then they would end up like the lady, Holly, who does the pinball tilt, and you don't want that. Okay.
Right, that's the limit, and I believe
Wow.
because we are brain injured, the brain injured parts plus the whole system as a whole is easy to hit that, and that's a huge part of the improvement. Someday I'll find someone that can talk about that, or I'll just talk about it, because that learning to what's the zone that it goes too far, and then you don't know really where that is, so you back up many steps and then try to work within that. Holly, you had a question?
Yeah, I'm just thinking about what you guys just said. Yeah, I lost from very super high energy and very productive, kind of lost all my capacities in all sorts of ways. Auditory processing, visual processing, cognitive, executive function, a bunch of stuff, but from the accident, from the collision. But my question is, this is a basic question. I should have asked this at the beginning probably, but can you very briefly, because I know it's could be a long thing, just explain what EMDR is and just the basics. So it's like the tapping, is it reconnecting all the nervous system, like where you're tapping, it's sending a message up to the brain? Is it recreating those connections that were lost, or whatever? Like what is it actually doing? I'm sorry, I'm like very basic. What is it like? What is the process? And then I hope this makes sense.
Yes, it does. So
Okay.
EMDR in general, if you understand how neural networks are made, it looks like a spider web with a nerve center, and all
Okay.
the spider webs are connected to other spider webs and let's say nerve centers, even though they're not, right? So if you ever seen a picture of it, this would be like the center of it with all the little spiderings coming off of it. And then this one might be connected here, and a different one here, and a different one there. Okay.
All right.
All of your networks are connected via thoughts. I'm a loser, or I'm a wonderful person. There's something wrong with me. And then once you bring that up, it's like, oh, yeah, I felt this way in this situation when I was giving this presentation or whatever. They're connected via the same emotions, same body sensations, or same or similar images. Okay. So with all of these connections, the way I look at EMDR is I am mitigating how many of those neural networks get lit up at the same time, because that will cause flooding or overwhelm and shut down the system. So I do more what's called EMD, and you desensitize first, and then you move into the reprocessing. Okay.
Okay.
So there's 3 different types of EMDR. EMD, which is just desensitizing. EMD
Okay.
little r, so you're only reprocessing that event. And then EMDR capital R, where any other car accidents you can bring in and you can treat a whole network at one time. And I love analogies. So if you consider a beaver dam, right? The beaver dam is holding everything back. And I think it was either Bessel or Yuri who talked about we all have a trauma load in our brain, and everybody's trauma load is different. And what's going to be that final straw that's going to break your trauma load? What I find in people with brain injuries is they're going along fine in life, whether there was a divorce or physical abuse growing up, they're managing. You get the brain injury, and now somebody just came in with a bulldozer and removed that beaver dam, and now you're flooded with memories from your past with all these emotions, and it feels like you're re-experiencing them all over again. So I approach EMDR like, we're going to look at this, and in the beaver dam, they have twigs, they have big chunks of wood, there's a bunch of leaves, there's some garbage, right? We're going to go in and we're going to remove some leaves. And then we're going to remove some small twigs. So along the way, the water or those neural networks and the blood flow starts to get some trickling in at a time. And that way nobody gets flooded.
So is it emotional, mental, or physical, or all of the above?
All of the above.
I
It is
think
the
what
only
you,
therapy that has a biopsychosocial effect, and it's proven. And can I show images? Am I still having host abilities, Dan?
Yeah, I never changed you out of that.
Good. Okay, so then let me get
I
the
think
pictures here.
what you just said, Dan, I'm wondering if you agree with this. To me, explains, at least to some extent, the positive impact that meditation has in rehabilitation.
So
Would you agree with
yes,
that, Dan?
and I would agree with that, but I would have to take a step back because to um encapsulate and reiterate what Michelle said, it's like it's kind of sad that we're all stressed and we're all traumatized, but I look at it as we had nervous systems that are everything is very synchronized and what's the word seamless, and then once that system gets injured, we have these internal problems that are all the problems that are injured in our brains, and we're experiencing them. We're all aware of them. I've talked to I think everyone here about their experiences.
What day you took it out?
And then you can't handle the stress, and then the emotional and psychological comes out. But I think because we have the core brain injury problems, the emotional and psychological is so much more, plus the regular traumas and the misunderstanding. The misunderstanding around all of it is still the thing that makes it so hard.
That makes it really hard. And from what I understand, I guess we're over capacity. And in my case, and probably a lot of others, I lost all my filtering processes for light, for sound, all that stuff. So the overwhelm is instant. But from what I understand, when you have a brain injury, instead of one area of your brain like lighting up and that's where you can focus and stuff, it's like all your brain gets turned on or lit up. And that's why. So it sounds like EMDR kind of starts helping your brain filter and not be all lit up all over the brain,
Yes.
if that makes sense.
The
Is that correct?
asynchronicity, yeah, the asynchronicity. So I'm speaking as a neuroscientist as well. The asynchronicity, the brain has certain patterns, certain activity, and certain functions that your brain has. It's like a ski slope that connectivity has refined over the years, and that's what you use. And then when those things get injured, there's a huge amount of noise and asynchronicity, and the EMDR helps to shift that. I actually, Dr. Morrissey can answer that part, but helps to shift that, improve that, and tone it down in a way to get it better. I don't
So
want to
you
say
can
back to
function.
normal.
Yeah.
Yeah.
So I'm going to show you some scans, and these are SPECT imaging. And this isn't a brain injury. This is just EMDR before and after.
Yeah.
So everywhere that's red, and this goes in line with what you're saying about how much is lit up in your brain. This is somebody PTSD, depression, and anxiety. What we find, and this is the back part of the brain at the bottom of the picture, so their occipital lobe, everywhere that they're seeing their trauma, their limbic system is lit up, everything, right? They would be prone to be more short-tempered, a shorter fuse, being inundated, not being able to cope with stress, right? And then you add the brain injury to it, it's going to make it worse. This is after 3 to 4 sessions of EMDR.
Wow.
Jesus Christ.
That's
Yeah.
amazing.
So this was back in the late 90s, early 2000s. Then the same psychiatrist did a study in 2019 on just PTSD. And this is within an hour. So the before is you walk in, you get scanned, you go out, you do EMDR, then you walk right back in and you get another scan. So this is within an hour, the actual changes that occur in your brain with EMDR.
That's
Wow.
incredible.
Yes.
Is this from the AMED clinic?
Yes.
So, did these results have a did they
Oh,
do
he
any
says
test?
here, limbic problems in patients with brain injuries and pre-existing mood disorders. So yeah, I guess I didn't even look at that before.
Did they have a correlation or testing of did this translate to things that they were able to perceive beyond just the test?
Oh,
You know,
I'm sure, but he didn't publish that.
yeah. That's an important piece.
Yeah.
Sometimes it's there, sometimes it's not. And I can just share that, my work and the discussions I have with brain injured people about what are you experiencing, what is injured in you. Oftentimes, the list of brain injury problems show that we all are the same, but in fact, there's drastic differences in what people are perceiving. And I think that talking to us and believing each person with what they're dealing with is a way to get at that. And also, if this is helping, if they say that it's helping them, then that's a huge factor. So,
Right.
yeah.
So I like my intake is thorough. Do you have headaches? How often are you having headaches? Are you having a hard time falling asleep or staying asleep? How many times are you woken up in the middle of the night? How long does it take you to go back to sleep after you're woken up?
Yeah.
What kind of depression do you experience? Does it lack of motivation? Is it just feeling low? What kind of anxiety are you worrying? Like I dig deeper into all of those things. What's your memory like? Right? Short term good, is short term bad, is your long term okay? Um, Trying to somatic complaints, where do they feel it? What's going on? Stomach aches, feeling nauseated, getting lost. One lady, and I
Hmm.
have her video on YouTube. She was a nurse who worked with a doctor who specialized in sports related brain injuries. She went camping, a big tent pole that big around hit her in the head because we got a big wind gust, like 60 miles an hour. The other side of her head, when she fell, hit a rock. So,
Jeez.
boom, boom,
Mm.
right? He said, you can't have a brain injury because there's delayed onset symptoms. She went to work. She was doing okay. A month later, everything hit her. And he said, no, no, that's not it. You must be going through menopause. This
Oh my
isn't related
God.
to your brain injury. This is so, yes.
This is
And
why we
they
get
did
annoyed with doctors, all of us
Western
in the brain
clinical
injury
medicine.
community. Yeah,
exactly.
exactly. Exactly.
So she ended up hospitalized because she said, I don't feel safe. She wasn't suicidal. She said, I don't feel safe. My brain and my body don't feel like they used to. So they hospitalized her psychiatrically, doped her up on a bunch of meds. I
Oh,
worked at a community mental health at the time. And oh, by the grace of God, she came to the clinic and I got to see her and I got to treat her. And then I found out there were how many other previous brain injuries that she didn't even recognize before, treated all of those within less than a year. She was off of her meds. She was
mm,
back to work part time because as a nurse, she's like, and so we look at the three prongs of EMDR. You work on the past, you work on the present triggers, and then you look to the future. What adaptations do you need to make to help you get through? How can you conceptualize a new life, right? If somebody's treating the past and they aren't doing the other prongs, you're not getting the full treatment. And you're going to have that water faucet that is still dripping or leaking, right? So she was able to go back to work part time for a month. She found out she was able to handle it, went back to work full time. She picked a different area to get into. It was either hospice or auditing or something, but still in the nursing field. Okay. So
How is your work being received by the health insurance
uh,
industry?
they actually love it because their clients aren't in therapy for 3 years, not getting better.
oh, good. So you're getting positive response to it. Oh,
I am
thank
getting
God.
positive responses.
Hmm.
Now, from
Good.
the doctors, like local doctors, like your therapist is telling you you've got a brain injury. That's
Yeah,
where I'm still meeting resistance is with
yeah.
medical doctors.
That doesn't surprise me. I've done a lot of work in healthcare. I don't even want to get started about Western clinical medicine.
Yep, I agree.
Um, it is so it
It's
is beyond
allopathic. If they can't just hand a pill to you, they don't know what to do. I
Yeah.
mean, that's my
it,
my low level
right. What
version
actually,
of what it looks like, but
you know, I'm finding this fascinating as hell. Are
Good.
you familiar with Dr. James Doty,
No.
Michelle? He's a professor at Stanford, or I don't know if he's retired or not. He wrote a book, Into the Magic Shop, written by this guy James Doty, who's an MD. and he's a neurosurgeon, and it has to do with the connection between the brain and the heart. He doesn't talk about brain injury in particular, but again, that brain injury is just a level of complexity on top of everything else that exists. Period.
Yes.
I disagree with that. Brain injury is
Really?
If brain injury was basically, the evidence is in how they don't understand it, don't know how to treat it, don't know how to help, and don't even have brain injury on their radar. It's its own condition. It's much, much, much. They don't know what we're dealing with.
I realize that,
So in
but
that sense, it's its own condition, is all I'm saying. Dr. Morrissey's pointed a lot of thinking about that as just circuits upon circuits upon circuits that create us, and when it gets injured, it doesn't make sense. And they also, the thing that bothers me the most about the doctors is that they don't have it on their radar, but they don't have the ability to be curious or listen to what we're dealing with.
Right.
That's kind of my motivation to do half of this stuff, because I run
yeah,
into
I don't think
it every day.
I don't think they're trained like that. I don't know what they teach you in medical school, but my impression is they basically teach you how to match up drug therapy or some kind of
Yep.
therapy with symptomology.
And it's not
Yeah.
only doctors, because it's also just the brain injury world as a whole doesn't know how to think about this. So
Yeah.
anyway, just to bring it back, Michelle, do you have any last comments or closing thoughts? Because I think
Oh, wow, that went fast.
Yeah, I know, right? That I look at it as I've got a caseload of 125, and that's more than most therapists I know, and I do all the heavy lifting. And if I have time to do the research, why don't medical doctors? What's wrong with them that they don't care about their patients to dig deeper? Why aren't they doing critical thinking? Right?
Yeah.
And then it hit me. Big pharma
Yeah.
is guiding insurance.
Yep.
They own the hospitals,
Yep.
They
and
have
they are
20
telling
minutes.
the doctors what they can do
Yep.
and what they can't do. So
Right.
it is a
Yep.
systemic problem that we're
Right.
dealing with.
Right.
Yep.
And we
Problem with
100%.
health, the problem with
Yep.
healthcare in this country is big pharma, hospital associations, medical associations, the insurance industry, and ultimately patients.
Yes.
And the food industry.
Yeah.
And unless I'm misunderstood, they're now being hyper specialized and siloed, I think is the right word. I'm not sure though. And they're not even doing whole body stuff anymore. They're only their one aspect, so they don't even know how the other things,
Right.
if
So
that makes sense.
changing
I'm
the
not saying,
carburetor in your car. The
yeah,
carburetor,
but they don't know the whole
take that
car.
out, replace the carburetor, and don't
Exactly.
worry about anything else.
Yeah, it's
Exactly.
backfiring. Why is it backfiring?
Right.
Well, you've got a
Right.
problem with this over your pistons, or yeah.
Right.
Yeah,
And
yeah.
TBI causes so many systems to not work properly. And if they're only working on the eyes or the ears or this part or that part,
Yes.
they're not getting to the actual cause, or not the cause, but the actual injury, I guess.
Goes back to that saying of you've got 12 blind people holding an elephant, a different part of it, and everyone describes it differently, but no one's seeing the whole elephant.
I've never heard that. That's a good one though.
No, I haven't heard that before either, but that's not a bad analogy.
It's a good one.
Yes.
It's an ancient one. So just for the record, I'm recording this, and I want to put this out in its entirety because we're all on the same page. So,
Awesome.
Michelle, you're okay with that, right? Because
Totally.
you said that we're all on the
Yes.
same page. Randy wrote a book about this. I want to put that in the notes. Randy, you're speaking from experience about the healthcare system. I think that the brain injury nature with that comprehensiveness is something that I'm finding across every person, and it's really cool to learn about this kind of treatment. And it's really sad to see how hard it is to get at, but it's good if you're doing what they approve of. So, yeah, I don't know. Maybe we could try to figure out a way to train more experts and disseminate this service. Yeah.
And that's what I'm trying to do is I'm trying to see here how many people I've trained so far in brain injuries. So I've been doing this actually since treating brain injuries with EMDR since 2009. And then I found out how many people weren't using it for brain injuries and developed a training in 2016. And now it's just like coming up where like, oh, there's something for brain injuries. So I'm really trying to figure out how to um, disseminate more information. And that's why these are huge. So let me just check my brain injured.
You know, what's really amazing about all this stuff with TBI is that there's 1.5 million to 2 million people just in the US who go through these injuries. There's 55,000 people that die every year in car accidents, and people go nuts. I mean, this is like a
Right.
massive epidemic.
Well,
is.
isn't it 1 every 9 seconds?
Whatever, but
Yeah.
you know, it is a step. My impression is a lot of attention is given to football players and veterans.
Yes.
And
Boxers, veterans.
football players generally will make enough money during their career that they can probably afford to do anything. Veterans, it's a different story. But there's lots of organizations around that help, you know, try and help veterans raising money for this, that, and the other thing. But I just find it, and if you look at the prison population, particularly among
Yes.
violent criminals, many of them are in prison because of one or more brain injuries that they've had in their life and how it's
Yes.
impacted their behavior.
Yep.
Um,
I've seen that.
You know, it doesn't mean that they should necessarily be released from prison, but
Different programs, different.
There's a
yeah,
bigger
I mean,
there's a bigger
so
picture going on here with brain
you are
injury. Yes.
absolutely right about big pharma. You know, EMDR, what got me through a lot of my stuff was, in terms of therapies, was the U of O, you know, cognitive rehab, speech pathology based, acupuncture, Tai Chi, which I never thought I'd be able to learn, something called sensory learning in Boulder, Colorado. Are you familiar with that, Michelle?
Mhm.
That had a profound impact, but I couldn't explain to you what it did. And table tennis. That's what got me through all this. And, you know, what I'm finding is, years ago, in a conversation with somebody at the Tai Chi studio, they were talking about the conscious mind is, you know, so big, the unconscious mind is multitudes far greater, far bigger, far broader, however you want to characterize it, than the conscious mind. And that's what I would sort of find the difference between the cognitive rehab, learning how to, you know, whether it's whatever that the cognition issues are, versus dealing with the emotional. And the emotional is far greater. And all of that, I mean, all of this is sort of like a circular reference, because everything is so integrated, so interconnected. And, you know, Doty's book, James Doty, the Into the Magic Shop, you can Google this. It's a relatively easy read. Touches upon this. And one of the things that I read in his book, which I've never heard before, is that that it is well documented through research that the heart as an organ has its own intelligence, and the connections between the heart and the brain. Well, when your brain is dysregulated because of injury and interruption, however, whatever that happens to be, then the communication between that and the rest of the body is not going to end up being synchronized, for lack of a better way of putting it. And hence, you know, here we are.
Yeah. And that's why you find people with heart transplants will all of a sudden start to crave motorcycle riding or pizza or going for like being in marathons, is that the host had those neuronal connections in their heart, and the new host is trying to make sense of it. And it's like, oh, I just have this desire to do that.
Gabor Mate, in his book, The Myth of Normal, he talks about some fairly well-known people, but one of the things that I remember from it was the people who tend to have the most chronic illnesses are those that have the nicest personalities. So in other words, if you become a bitch, you'll probably live a long life.
Well, you know the saying, only the good die young, right?
What's that? What's that?
Only the good die young?
Yeah, right. Yeah, exactly. Only the good die young. Right. I mean, the subtitle of his book is Healing from Trauma in a Toxic Culture. And if this, I mean, the US, I mean, I've read this book twice, and I've walked away with the US is probably the most toxic culture in the planet. I don't know about the rest of the world, but I'm sure parts of it are probably not much different.
Yeah.
There's,
So I checked my Excel spreadsheet and I've trained probably 55 to 60 people. And so it's
Scattered
not
all over.
all over the US, Canada, and England. So I'm trying to reach out to people I know
Yeah.
in Australia to get the training out there, bring awareness. And there's some states here that there's nobody trained. And I'm really trying to enhance that. So I can't treat every state, like I
Have you
said.
tried going through approaching the training part by approaching institutions? For example, maybe a medical school or something like that.
They would have to be basic trained in EMDR first in order to
Right.
take it because it's an advanced class. But I could look at that. Thank you.
part of the problem there is that the
There's
institution,
resistance.
yeah,
They're
they're a lot
resistant.
like the doctors that we were just talking about. There's drastic resistance across all of this, and the UK and Canada are places where I've seen a more advanced perspective out there. So that's cool.
What are sort of the prerequisites for this particular training? You'd mentioned that this is an advanced training. Is this like, do you need licensure? Do you need to
Yeah.
be like an LM, all of the all you know all
Have
of
to be licensed. They have to be basic trained, and they have to have an interest or some experience in brain injuries.
Do they
Because
have to
then
be
I
a
give them the
psychologist or
rest.
therapist of some kind? Do they have to be do they have to be licensed already as a therapist or psychology or psychologist or anything like that? Is that
They can take basic training once they're in their internship. But then they're just practicing the basics. So they have to have some years of basic before they jump into brain injuries, because you have to understand how EMDR works first before you add an advanced level to it.
okay? What it's going to come down to is money. And if
Mhm.
you're able to save them money I mean, you touched upon it earlier,
Yes.
the health
Yes.
insurance industry. If you're able to save them money, they could very well be receptive. Forget about, and that's not even getting into the social implications of this.
Right.
I think that there's multiple issues and there's multiple levels, but having a sort of bottom-up approach that is effective and generalizable has globalized effects for more people, plus demonstrating it, plus getting them to believe us, because that's the biggest hurdle. And I actually don't blame those doctors and clinicians. I've decided about this a while back. It's just how unbrain injured people look at brain injury. It reminds me of PTSD and World War One, where they used to shoot their
Yes.
people because they couldn't function. They don't know how to put their mind around it. I have a talk hopefully with a speaker who worked at Walter Reed in military research, and she said before their research they thought you're either lying or crazy, which is kind of consistent with how the rest of the world looks at brain injury if they don't know
Yes.
how to think about it. So,
Yeah.
thank you, Michelle. This has been really
You're very
informative.
Yes,
welcome.
thank
Thank you for
you.
inviting me. Yeah.
Yeah, and
Yeah, I gotta tell you, Michelle, I thought this was absolutely fascinating.
Good. I'm glad. And we
Um,
just scratched the surface. So if you ever want to do a part 2, let me know.
I'd be
Okay.
happy to. I'd be happy to, and we could get into any other questions.
Yeah,
Um,
if they come up with questions, and then we can keep part 2 maybe more focused to specific things rather than today. It was like the umbrella, and let's talk about it and how it can help and all of that. But I would be open to that. Okay.
Well, that was really great, and the umbrella, as you described, is similar to the umbrella that I've been writing to try to capture the nature of the parts of the umbrella. But I believe we're viewing the same parts, and then how to understand it is only good if it can be helped or lead to things improving. So that's where what
Yes.
you're doing, I think, is so amazing and can be combined with other so many other assets out there. So okay, and yeah, I'm probably gonna keep most of what was discussed in the recording, more or less, especially the criticisms of what is out there,
Mm.
which ultimately it's for the benefit of this fight, for the benefit of what brain injury people are needing. It's not a criticism to be mean. It's a criticism to help them understand what we're dealing with.
Well, it's a lived experience by most of us, if not all of us.
And you
Great.
guys are very welcome. Thank you for inviting me. I really appreciate it. I wish I could get to know all of you and hear your stories and then explain how EMDR could help you personally. Or if not, but maybe another time, you will get my email or website. So you are free to reach out. Hey, do you have somebody in my state you trained? I can do that as well.